So, just a short description of our topic. Acute lymphocytic leukemia, which is also known as ALL, is a type of cancer that starts in the bone marrow. And if it is not treated quickly, it will be fatal within a few months of developing it. ALL is also the most common type of cancer in children. So, ALL is first caused by bone marrow cells developing errors in their DNA. And these errors let the cell know to continue growing and dividing. But in a healthy cell, these cells would normally stop dividing and die off. So, when these cells with errors continue to grow and divide, blood cell production becomes abnormal, and the bone marrow continues to produce immature cells that will eventually develop into leukemic white blood cells called lymphoblasts. And these abnormal cells cannot function properly, and so they usually build up and outnumber the healthy cells. And unfortunately, research does not show what causes these DNA mutations that lead to ALL, but doctors have found that most cases are not inherited. So, some factors that may increase the risk of developing ALL include previous cancer treatments such as chemotherapy and radiation therapy, genetic disorders, and having a sibling with ALL. Signs and symptoms for ALL actually mimic symptoms of the flu, but obviously, if you have the flu, the symptoms will go away after a week or two. But if these symptoms are persistent after about 2 weeks, there may be concern for ALL. But some more specific standard symptoms for ALL also include bleeding from the gums, bone pain, fever, frequent infections, frequent or severe nosebleeds, lumps caused by swollen lymph nodes in and around the neck, underarm, abdomen, or groin, pale skin, shortness of breath, and weakness, fatigue, or a general decrease in energy. So the main treatment for ALL is chemotherapy. And as I'm sure some of you guys know, chemotherapy uses anti-cancer or cytotoxic drugs to destroy cancer cells. And these drugs are injected into the vein and then circulate throughout the bloodstream. This chemo treatment is usually divided into 3 phases. And the first one is called remission induction, which is used to get rid of the ALL. And then the second phase is consolidation, which is the treatment to stop ALL from coming back. And then the last one is called maintenance, which is used to keep ALL away long term. So radiation therapy is another form of treatment that is used to kill cancer cells. And radiation therapy is also my major. So this treatment relates to my field of study because in my future career, I'll be the one planning and administering the prescribed doses of radiation, preparing patients for the treatment, and also working the machines to deliver the beams of radiation. But since ALL is a blood-related cancer, radiation therapy is usually only necessary when the cancer cells have spread to the central nervous system, because radiation therapy is more of a targeting approach to a specific area of the body rather than chemo, which circulates throughout the bloodstream.
In order to diagnose ALL, doctors perform many tests. This includes a physical test and history of the patient, a blood test called a complete blood count, which will look at the number of red blood cells, white blood cells, and platelets in the patient, and then a bone marrow examination that will take fluid from the bone marrow to confirm the diagnosis. A sample is obtained of a bone marrow aspirate, where doctors will take a small amount of fluid where blood cells are made. Then they examine the fluid under a microscope to confirm the type of cancer before they begin treatment. My intended field of study is physical therapy after my undergraduate. This subject relates to physical therapy as it can be beneficial to intervene with leukemia or any kind of cancer that weakens the body after chemotherapy to help keep a normal gait and endurance as the body is weakening. I can use this field of study to educate patients about the impact the cancer is having on the body to make it weak as the cancer cells are taking over the normal blood cells. This relates back to anatomy and physiology as we are learning about blood vessels and the different aspects of blood. Blood vessels contain red blood cells, white blood cells, platelets, and plasma. In acute lymphocytic leukemia, immature leukemia cells accumulate in the bone marrow. This destroys and replaces cells that produce normal cells. Bone marrow contains many blood vessels where new blood cells are being created. As the number of leukemia cells increase in the blood and bone marrow, there is less room for the healthy blood cells. In acute lymphocytic leukemia, white blood cells are extremely high, and from the high number of white blood cells, the blood flow is impaired. The leukemia cells are carried in the bloodstream to the liver, spleen, lymph nodes, brain, and testes in males, where they may continue to grow and divide. This can spread to the layers of tissue covering the brain and spinal cord eventually and cause anemia, liver and kidney failure, or any other organ damage. ALL relates back to the gut microbiome because the gut microbiome in someone with good health participates in metabolism processes and regulating our immune system. There have been studies investigating the potential relationship between gut microbiome and childhood leukemia. In children with leukemia, drugs using chemotherapy and antibiotic treatments can disturb the gut microbiome, which can damage the protection and immunity balance. It has also been investigated that the gut microbiome can predict infection risk during chemotherapy.
Scene 1, two moms having coffee.
So my kid, she's just been like super sick lately, and I'm just so worried about her. You know, as a nurse, I just figured she has the flu because the last 2 weeks she's just been really nauseous, and you know she has a fever. But it's been over 2 weeks, and she's just like so lethargic, and she has body aches, and she's just super pale and has these really weird nosebleeds, and I don't know like what to do, and I'm just so worried about her.
It's so weird. Do you think she should go to the doctor?
I mean, I guess I just kind of figured I could handle it on my own.
I think she should go to the doctor.
You're probably right.
Me too, at the doctor's office with my child.
Hello.
Hi.
So after looking at Sally's physical examination, her history, and her blood cell count, she has a very abnormally high amount of white blood cells. And so our next step will be looking at her bone marrow.
What does that mean?
Well, it's too early to diagnose, so we're just going to have to look at the bone marrow and see what it says and go after that.
If you are experiencing any symptoms that include bleeding gums, easy bruising, infection, nosebleeds, red spots on the skin, shortness of breath, swollen lymph nodes, or weight loss, you may be at risk for ALL.